Hi, this week's video is on Mycobacterium tuberculosis, which is the causative agent of tuberculosis. So what makes Mycobacterium tuberculosis so hard to treat, which ultimately leads to tuberculosis, is that the bacterial cell wall is coated in like this waxy mycolic acid surface. And so what happens is that normal antibiotics with a bacterial infection would adhere to the cell wall surface, and it would go into the bacterial cell through endocytosis, and it would begin the process of attacking the bacteria and begin treating the infection. But what's different about tuberculosis and common bacteria is that tuberculosis, or the Mycobacterium tuberculosis, acts more as a virus. And so what happens is that when you're infected with Mycobacterium tuberculosis, it goes into your cells and it begins replicating inside of the cells, which is just all wonky because that's not what bacterial cells are supposed to do. That's what viruses do. And so it makes it really challenging to be able to treat the disease, the tuberculosis, because it doesn't have the ability to just adhere and stick to the surface of the cell wall and then start doing its little magic. Organisms grow slower, and it causes a chronic disease that can infect any area of your body, so not just the lungs. So this is what the textbook states, is that due to your body fighting this chronic infection and this disease that is just replicating inside of your body, it begins to infect other areas and other organs. And so if it were just the lungs, it would possibly be easier to treat tuberculosis. But in this instance, with this bacteria specifically, it just doesn't really do what it's supposed to do. So it just kind of acts out of the normal behavior of bacteria. And that just, again, adds to the challenging factor of actually treating it and eliminating it from a person's body. So after the bacteria enter into your lungs, so it's caused through droplets or aerosols of an infected person. So again, it's always important to cover your coughs and your sneezes with your elbow, not with your hands. So once this enters into the alveoli through inhalation, it causes an inflammatory response and an accumulation of neutrophils and macrophages in the area. So once it's taken into your lungs, then all of the normal, the white blood cells or the macrophages that are supposed to eliminate bacteria, they all kind of go, and they're like, hey, what's this, right? There's no memory cells for this. So you've never, you don't have this and then it goes away. This is just something that once you get tuberculosis, that's something that you have. And so all of these normal responses to bacteria are happening, but it's not really helping. And so after some time, the lesions begin forming tubercles, and how do you even say that? Tubercles. And the bacteria continue releasing the infection. And because of the chronic immune response, it results in tissue damage, and apoptosis begins, which is house sow death by the process of liquefaction. So liquefaction creates air pockets that allow the aerobic bacteria to grow and multiply. So eventually these tubercles, they rupture, and the bacterial cells invade the pulmonary capillaries, and it spreads throughout the bloodstream and all the other organs. So the lecture states that the Mycobacterium tuberculosis is a gram-positive bacillus bacterium. And again, that waxy cell wall surface just makes it really hard to treat. And 9 out of 10 patients have the latent form of TB, which is just like this dormant form. It's asymptomatic. You don't even technically have the disease until it becomes acute. And those symptoms of acute tuberculosis are cough, fever, night sweats, weight loss, fatigue. And TB becomes active when the immune system cannot stop the bacteria from growing inside of the system. So even though you have a latent form of TB, if it is detected, it is really important to begin treatment so that you don't actually develop tuberculosis. And TB is the leading cause of death for people who have HIV, and it's a slow progression of the disease. I actually lost a cousin to complications from HIV, and the cause of his death was tuberculosis. So I hope you enjoyed the video.